Welcome back, everyone. I got a lot of newbies here today. This is kind of fun. I have with me Dr. Gil Reese, if I said that correctly.
Correct. Thank you.
He is the CEO of Freedom Medical. And you're an addiction, you have an addiction practice, and
Yes.
you're here to educate us on substance abuse. Welcome to the show, and it's huge.
Thank you very much, and I appreciate it. First of all, I'd like to give the mission statement because I'm dealing with a very controversial topic and which really has the attention, I think, everybody in the United States in one form or another. The purpose of my practice is to take the chronic opioid addicted or alcoholic addicted individual to detoxify faster with increased odds of a sustained recovery. The message of Freedom Healthcare is detoxify, sustained recovery, and healing. I realize that's a lot to say. However, the problem is sustained recovery. Harvard has defined that as basically it takes 8 years of attempted detoxification along with, if you will, only 40 to 60% of those people to be treated with at least 4 to 5 admissions to rehab before they can reach sobriety. Well, if we take 40 to 60, that's 50%. That's just within the realm of medical probability. So here we have a problem that has really a coin toss chance of really being totally rehabilitated in a sustained way. So the recidivism rate is kind of high, and it has to be addressed. Unfortunately, this is one of the reasons why I've come here. Having practiced neurological surgery, family practice board certified, as well as prison medicine, the stages of detoxification require either medical adjustment, we call medicated assisted treatment with different medications, and lastly, interaction with other healthcare providers. So in regards to the problem of detox, which is the most brutal thing a human being can go through, especially if it's opioids, it's so horrendous to witness, especially when I've seen it in the prison, is anxiety, diarrhea, tremors, sweats, chills, insomnia, and rapid heartbeat, really not thinking well. It usually takes 2 to 6 weeks for these people to detoxify before you can do anything with them. They're on constant medication. And the real rough part, even if you're doing it in a rehab center or in a prison, it takes a lot of time, effort, and finances, and we don't get the results that we want. Having said all that, technology is a very important thing because medicine doesn't advance without technology. For me in the beginning, it was the CAT scan and the MRI scan. Well, now, due to a company, which I will mention in a minute, detoxification has now rates right along with this device as a cardiac pacemaker or defibrillator. So, Innovative Health Solutions was granted approval by the FDA in November 15th of 2017. This device is very simple to apply. You don't have to be a neurosurgeon, but having surgical experience would account. The device is no bigger than a hearing aid. It's placed either behind the right or left ear. Electrodes are attached to it, attached actually to the ear, the same side as the generator. It's called a field generator. And slight impulses go into the ear. This gives access to what we call the limbic system, which is cranial nerves 5, 7, 9, and 10. Along with the occipital nerves. The limbic system is the one that gives all the symptoms of the nausea, the vomiting, if you want muscle tweaking, diarrhea, constipation, and actually calms it. It takes about 20 minutes to apply, and after they wear it for about 20 minutes, their symptoms of withdrawal are gone, resolved. Does it work all the time? Patient selection, that's the key factor. What's nice about it is that to do it this way, you don't have to put them in the hospital. If you catch it early, it's done electively. Or if somebody is in the hospital and has been recently discharged, typically what will happen is somebody comes in severe drug withdrawal. What happens next? They stay for a few hours and then they're released. Well, instead of releasing them back home, if they make an appointment, which is an elective thing, we can put that device on them. And within 5 days, believe it or not, they're completely detoxed.
Let me ask you something. I got to ask you. First of all, are you the only one that has this?
No. I'm glad you brought that up. In Pennsylvania, Pennsylvania, there are 3 counties that now are trying this out on their patients.
But here in Arizona,
I know 2 devices have been sold. I have no idea where they were sold or what's going on, but I would say no.
okay.
So there might be somebody out there that did it once, but they're not being very aggressive of promoting it.
So what you're doing is trying to get the word out about it because it's awesome.
I'm trying to be very proactive.
Can I ask you a couple of
Yes.
questions that are off the cuff? You
Sure.
let me. You said I could do that before we
Yes.
came on. Is it covered by insurance?
No.
Okay, but I didn't think so, and I'm sure most
But it's a
people
lot
didn't.
cheaper than going to a rehab center and spending $30,000.
So you could go, instead of going into rehab,
Right.
you would go to you and you would put this device on them and they wear it. Do they wear it only for 20 minutes and then they stop
No,
and put it off?
they-
How long does it work?
I think I forgot to add the fact that it's worn for 5 days. It turns itself on and off every 4 hours.
That's why I asked.
It's a technical type of thing. At the end of the 5.5 days, we remove it, and then we put them on medical assistant treatment.
Now, during that 5 days, then they're not in a hospital setting; they're home.
They're home, right?
And
They're
is it
functioning.
best that they stay home, or is it, or what is it best?
To resume normal activity? Our idea is to get them out of the searching for drugs,
Awesome.
waiting for their next shot. Go out there, enjoy yourself.
So who's ready for the treatment? Who is that person? I mean, is it for somebody who has been on for a very long time, whether it's alcohol, does it matter?
Nope.
Okay.
Whenever we'd like to get them as soon as possible. We'd like to really decrease those people that are using drugs and alcohol. But the highest death rate, as you know, is in the opioid family. And basically, lifetime, once you start that and really into it, it's only 8 years.
Does it
Really?
matter if they're hooked? Because, a lot of people are hooked on a lot of different things. Does it matter how long they've been doing it?
Yes, it will have a profound effect, and that goes on to the third phase. Well, how do we have sustained recovery?
Go ahead.
Because the neural pathways have been destroyed. And when they're destroyed like that, it has to do with the dopamine system, is that the receptors themselves basically atrophy and brings back the cravings and all the other, although they may be on no drugs. That's the risk.
I need to tell them your information because, I got very into what you were saying, and I'm sure a lot of people did, because there's so many people out there, whether it's you or someone that you know somebody who's dealing with an issue, right?
Correct.
And so that's why I wanted to stop you there for a second to get this information out. His website is freedommedical.net. He does a free 15-minute consultation to talk to you guys. The phone number to call is 480-272-7023. You got to check it out because this is very new information. Go ahead. More stuff.
More stuff. Okay.
Let's talk.
So the second stage is it's medical assisted treatment. It can be done either with narcotics. Methadone is the most common, and that is a true narcotic derivative of heroin that was developed before World War II by the Germans because they're preparing for World War II, and they wanted to make sure that their soldiers were appropriately managed as far as pain care. The next drug that came out was buprenorphine. That was developed in France as an outpatient as well as inpatient. They have the most experience with this drug, and I'm getting all that material I can from France that I can sit down and do a little more investigation. I do have access to the people that actually worked on it. The idea is to get the statistics. Now, buprenorphine, as you know, you can go and say, well, I need treatment, and all you see is a long list of doctors that do it. But what really were the results? They still use buprenorphine in France. Nobody has studied it as well as the French, so I'm trying to steal some of their thunder and fire, if I will, and see if we can apply it here in the United States.
Well, we only have a couple of minutes, and I can go on and listen to you forever.
No, that's okay.
Because it's important. What information is really good.
But what we use, my second step would be the use of Vivitrol. It's a shot, and what it does, it blocks the mu receptors. That's the endorphin receptor sites in the brain, which we naturally have. So it will actually displace any narcotic, heroin or anything else immediately. They will go into major withdrawal. So you have to make sure that they're almost complete with their detox before you issue this drug, because you can cause major complications.
So there's no therapy involved? I mean, most people think that you need therapy afterwards.
Oh, hold on. That's the most important part, because remember, we're looking for the sustained recovery, and I haven't seen anybody doing anything. $30,000 to $40,000 for rehab, drug rehab, and then you have to go back 5 times in 8 years in order to be, whatever the term or definition of sober is. So actually, I talked to a person the other day, an attorney that's an expert in this type of, and basically why they stopped reinvest. It's a poor return on your investment as far as trying to rehabilitate these patients in that situation. So my cost is basically half what it would be for an individual that goes into rehab. Not everybody's a candidate for my program. My obligation and moral obligation as a physician, since we created the problem way back when, is to really be proactive. And for example,
Go ahead.
For example, I've gone out into the community, the Chamber of Commerce, to make connections so they can see that I can help my patients.
And to be placed on here to get the word out to everybody, you got to check it out. It is freedommedical.net. He does free 15-minute consultations. His phone number is 480-272-7023. Whether it's you or someone that you know, let's tell him about it.